Hey, what's up everybody? Dr. Mike here, and I'm excited to be teaming up with my friend Kelly in her CSEC Science Series production to bring you this ultimate guide to preventing and treating nutrient deficiencies, along with a few physiological disorders associated with nutrition. We're going to dive deep into dietary recommendations that can make a world of difference. We're talking about managing conditions like diabetes and hypertension, and tackling those lesser known but equally important deficiency diseases head on. Get ready to take some notes because we're about to drop some serious knowledge bombs. Let's do this. All right, first up, let's talk about diabetes. Now, diabetes is all about managing your blood sugar levels. When we eat, our bodies break down carbohydrates, including starchy foods, into glucose, which is a type of simple sugar that enters our bloodstream. Insulin, a hormone produced by the pancreas, helps our cells absorb that glucose for energy. But with diabetes, the body either doesn't produce enough insulin or can't effectively use the insulin it does produce. This leads to elevated blood sugar levels, which can cause a whole host of problems over time. But the good news is, diet plays a huge role in managing diabetes effectively.
Think of your plate like a balancing act. We want to focus on foods that promote stable blood sugar levels and prevent those dangerous spikes. One of the most important things you can do is choose low glycemic index foods. The glycemic index ranks foods based on how quickly they raise your blood sugar. Low GI foods are digested more slowly, resulting in a gradual release of glucose into the bloodstream. This means no more energy crashes and better blood sugar control overall. Think whole grains like brown rice and quinoa, steel-cut oats, sweet potatoes, and plenty of non-starchy vegetables. These are your new best friends.
Next, let's talk fiber. Fiber slows down the absorption of sugar into the bloodstream, which helps prevent those dreaded blood sugar spikes. Aim for high-fiber foods like beans, lentils, fruits, vegetables, and whole grains. And finally, remember that portion control is key. Now, let's tackle another big one, hypertension or high blood pressure. This is a condition where the force of your blood against your artery walls is consistently too high. Over time, this can damage your heart and blood vessels, increasing your risk of heart attack, stroke, and other serious health problems. But just like with diabetes, the right diet can make a huge difference.
And when it comes to hypertension, it all starts with sodium. You see, when we eat too much sodium, it causes our bodies to retain water. This extra fluid increases the volume of blood in our blood vessels, which in turn raises blood pressure. So step one is to cut back on processed foods, fast food and restaurant meals, which are often loaded with hidden sodium. Aim for no more than 2,300 milligrams of sodium per day, which is about a teaspoon of table salt. But ideally, you want to shoot for even less than that.
Now, while we're limiting sodium, it's important to make sure we're getting enough potassium. Potassium helps to relax blood vessels and excrete excess sodium, which can lower blood pressure. Load up on potassium-rich foods like bananas, sweet potatoes, avocados, beans, lentils, and leafy green vegetables. You might think of scurvy as a disease of old-time sailors, but the truth is it still exists today. Scurvy is caused by a severe deficiency in vitamin C, an essential nutrient that our bodies can't produce on their own. Now, scurvy might sound like something out of a history book, but it's still a real concern, especially for people who don't eat a balanced diet. And the symptoms are no joke. Fatigue, weakness, joint pain, bleeding gums, and slow wound healing. Not exactly a walk in the park, right? But the good news is, preventing and treating scurvy is pretty straightforward. Get enough vitamin C. Citrus fruits like oranges, grapefruits, lemons and limes are all excellent sources of vitamin C. But don't stop there. Strawberries, kiwi, bell peppers and broccoli are also packed with this essential nutrient. So, make sure you're getting a variety of colourful fruits and veggies in your diet every single day. All right, let's talk about rickets. Rickets is a bone disease that affects children, and it's caused by a deficiency in vitamin D, calcium or phosphate. These nutrients work together to build strong, healthy bones. parent. Without enough of them, children's bones can become soft and weak, leading to bone deformities, delayed growth, and even skeletal pain. Now, vitamin D plays a particularly important role here because it helps our bodies absorb calcium. And while we can get some vitamin D from foods like fatty fish, fortified dairy products, and egg yolks, the best way to boost our vitamin D levels is through sunlight. Parent, that's right, sunshine is actually good for you. When our skin is exposed to sunlight, it produces vitamin D naturally. But how much sunlight you need depends on factors like your skin tone, the time of year, and where you live. Let's move on to another important nutrient deficiency, pernicious anemia. This type of anemia occurs when your body can't absorb enough vitamin B12, which is crucial for making red blood cells. Red blood cells carry oxygen throughout your body, so without enough of them, you might experience fatigue, weakness, shortness of breath, pale skin, and even neurological problems. Now, pernicious anemia is most commonly caused by an autoimmune condition that attacks the cells in your stomach that produce intrinsic factor, a protein that's essential for vitamin B12 absorption. But it can also be caused by dietary factors, like following a strict vegan diet without proper supplementation. Treatment for pernicious anemia typically involves vitamin B12 injections or high-dose oral supplements, so make sure you're eating plenty of B12-rich foods like meat, fish, dairy products, and fortified cereals. Let's talk about beriberi, a disease caused by a thiamine deficiency. Thiamine, also known as vitamin B1, is essential for our bodies to convert food into energy. It plays a crucial role in nerve, muscle, and heart function. Now, beriberi is relatively rare in developed countries, but it can still occur in individuals who have a poor diet, abuse alcohol, or have certain medical conditions that affect thiamine absorption. There are two main types of beriberi: wet beriberi and dry beriberi. Wet beriberi affects the cardiovascular system and can lead to heart failure. Symptoms include shortness of breath, rapid heartbeat, leg swelling, and even waking up gasping for air at night. Dry beriberi, on the other hand, primarily affects the nervous system and can cause numbness, tingling, muscle weakness, and difficulty walking. The good news is beriberi is treatable with thiamine supplements, so load up on whole grains, pork, legumes, nuts, and seeds. Now let's tackle a very common iron deficiency anemia. Iron is essential for producing hemoglobin, a protein in red blood cells that carries oxygen throughout the body. When you don't have enough iron, your body can't make enough healthy red blood cells, leading to fatigue, weakness, shortness of breath, pale skin, and even hair loss. Iron deficiency anemia can be caused by a number of factors, including blood loss, like heavy periods, pregnancy, a diet low in iron, or an inability to absorb iron properly. The good news is, treatment for iron deficiency anemia usually involves taking iron supplements to replenish your body's iron stores.
You can also boost your iron levels through your diet. Iron from animal sources, called heme iron, is more easily absorbed by the body than iron from plant sources, called non-heme iron. So, if you're looking to boost your iron levels, make sure you're including plenty of iron-rich foods in your diet, such as red meat, poultry, fish, beans, lentils, tofu, fortified cereals, and leafy green vegetables. And here's a pro tip: vitamin C can actually enhance the absorption of non-heme iron.
Finally, let's talk about goiter, a condition that affects the thyroid gland. The thyroid gland, located in your neck, produces hormones that regulate your metabolism. Iodine is an essential mineral that your thyroid gland needs to function properly. When you don't get enough iodine, your thyroid gland can become enlarged, resulting in a goiter, a swelling in the neck. Now, goiters are more common in areas where the soil is deficient in iodine. Good sources of iodine include iodized salt, dairy products, seafood, and eggs. In some cases, your doctor may recommend iodine supplements if you're not able to get enough iodine through your diet alone. That was a lot of information, but I hope you found it helpful. Remember, addressing nutrient deficiencies through diet and supplements is essential for preventing and treating these diseases. Regular checkups and a balanced diet are key to maintaining optimal health. Thanks for watching and stay healthy.